I am Sarath Chandra Mouli Veeravalli. I am the Clinical Director in the Department of Rheumatology and Clinical Immunology. Today, I would like to share with you the common rheumatological diseases we come across in our clinical OPDs. First disease is rheumatoid arthritis. This is a very common disease we come across in our rheumatology OPDs. The common symptoms in rheumatoid arthritis are joint pains and swellings in both the hands and feet. The swollen joints will affect the small joints of the fingers on both sides of the body. Suppose if I get rheumatoid arthritis in the left wrist, I will get arthritis symptoms in the right wrist also. If it affects the left thumb, it affects the right thumb also. This is called symmetrical polyarthritis. So the knuckles look like exactly drumsticks in rheumatoid arthritis patient. And the patient typically tells more stiffness, more pain and stiffness in the morning, usually more than 45 minutes to 1 hour. This is the classical stiffness in inflammatory arthritis. The common symptoms are the joint pains and early morning stiffness, but other symptoms depending upon the system involvement. Some people may get dry eyes, dry skin, dry mouth, difficulty in chewing. This is called Sjogren's syndrome. So, few patients of rheumatoid arthritis may have these dryness symptoms. This is called Sjogren's syndrome. The next disease I would like to discuss is psoriatic arthritis. Psoriatic arthritis, the symptoms may mimic exactly like rheumatoid arthritis, but they will also have skin disease called psoriasis. The skin will become very dry, rough, and when you scratch, the patients will notice scaling of the skin. This is called psoriasis. Mostly you see on the dorsum of the hands, on the elbows, knees, belly button, armpits, groins, and also on the back. These are the common areas, and also of the scalp in some patients. So, if any patient develop arthritis with the background history of psoriasis, this is called psoriatic arthritis. The third disease I would like to discuss is ankylosing spondylitis. Ankylosing spondylitis is also a type of inflammatory arthritis affecting several joints in the body, but typically they will have severe back pain. The back pain is more in the morning, usually more than 45 minutes to 1 hour. As soon as they get up from the bed, they notice severe pain in the back. And some people also complaining of difficulty turning, difficulty in rolling on the bed from side to side, and alternate buttock pains. This is what we call inflammatory back pain. This is another differential for sciatica. Most of the people, if they get back pain, they think of sciatica. But if they have early morning stiffness of more than 45 minutes to 1 hour, along with the joint pains, think of ankylosing spondylitis. In these patients, HLA-B27 blood test would be positive in most of the patients, and ESR would be high. And if we do imaging of the neck, back, and spine, and also the affected joints, it will show the signs of arthritis. Typically, the pelvic X-ray would show sacroiliitis. If the X-ray is normal, we may have to do MRI of the sacroiliac joints. Most of the patients, it would be positive. The fourth disease I would like to discuss is lupus or SLE, systemic lupus erythematosus. This is mostly seen in females. 9 out of 10 patients are females. The common symptoms are significant hair loss, and when they get exposed to sun, they get a typical butterfly shaped rash on the face and recurrent mouth ulcers, along with joint pains and swellings like rheumatoid arthritis. These are the common symptoms of lupus. They may have other symptoms and signs depending upon the system involvement. If the blood is affected in lupus, they may have low HB, low white cell count and low platelet count. And if the kidney is affected, they may lose protein in the urine. And if the nervous system is affected, they may get neuropathy. If the brain is affected, they may get psychosis or fits. And it may also affect heart, causing myocarditis and heart failure. It may affect lungs, causing what we call interstitial lung disease, where the lung tissue is replaced by fibrous tissue. So, the common tests we run in these patients are ANA and double stranded DNA. The third one is ANA profile. The fifth disease I would like to discuss is juvenile rheumatoid arthritis. This is seen in children. The symptoms are depending upon the type of arthritis. There are 5 variants in juvenile rheumatoid arthritis, and the signs and symptoms depending upon the type of juvenile rheumatoid arthritis. Like in adults, they will have joint pains and swellings. They may also have fever, significant fever on and off, and they may also have red type of erythematous rash on the body along with the fever. Juvenile rheumatoid arthritis patients. The sixth disease I would like to discuss is gout. In gout, the uric acid in the blood will be very high. This excess uric acid in the blood may accumulate in the joints and it would cause severe arthritis. The common place is the great toe. The symptoms may subside with painkillers. Sometimes the symptoms may go away on its own, and the similar symptoms may happen again after 3-4 months. So, this is different from psoriatic or rheumatoid arthritis. So, typically in gout, the patient would notice between attacks, symptom-free interval may be weeks or months. Whereas in rheumatoid and psoriatic arthritis, the symptoms and signs would be very much continuous for weeks and months. Whereas in gout, the attacks are intermittent. So, between the attacks, the patient feels very much normal and may not need painkillers at all. And the uric acid levels would vary with the type of diet we take. Red meat, seafood, alcohol would cause increase in the levels of uric acid. So, the gout patient should avoid these kind of foods.